My name is Oswaldo Scopin de Andrade. I'm from Piracicaba, São Paulo, Brazil. I give lectures around Brazil, South American, and worldwide, speaking about aesthetic dentistry and also implant dentistry. I have my private practice in Piracicaba, which is a city close to São Paulo, around an hour and a half. And as educational, I have a close contact with like two institute in Brazil. I am a director of the advanced program in aesthetic and restorative dentistry at Senac University in São Paulo. And also I teach at the CETAL Institute, also in São Paulo, and ILAPEL in Curitiba, Paraná. I always try to focus my lectures on new trends. I always try to give guidelines for the people who I lectured for, to show new techniques and new trends in aesthetic and implant dentistry. I think the most important thing today is we have to think dentistry as a medical area. We have to think for years, dentistry thinks as in a more technical way, like more about ceramic, more about materials. And now we are moving toward that we have to be more conservative. We have to be conservative in implant dentistry. You have to be conservative when we extract a tooth. So the conservative mind, the minimally invasive procedures are everywhere in dentistry. That's, for me, is the most important thinking that we have to do. I think every dentistry, every dental technician, everybody who deals with dentistry must have an educational mind. It means everything changes every day. We have to have an open mind to understand why the things are changing. We have to understand if it can be applied in your office or not for our patients. We have to be critical. We have to understand everything. We have to study a lot. This, I think, is the most important thing. That's what I like about the Guide Institute. They are always changing things. They are giving opportunity to people worldwide watching different opinions about different situations. I think the educational mind, the open mind, I have helped us to give a better dentistry to all of our patients. That's what I think is important. Oh, sure. I think that, of course, when you see a lecture, you learn a lot. When you go to a conference, you learn a lot. What is important, you have to be in a group. What I like a lot, like sort of studies group or discussion groups that you can express yourself, show your thoughts, how do you think, how you can do it better. Another thing in my area, for example, the restorative dentistry, I think we have to work as a team always. For my private practice and in our courses, it's very important to be close to a dental technician. I think the professional relation between clinical dentistry and laboratory dentistry should be really close. We have to think like as a team, always, always, always. Sure. Ceramic is a more, we can say that's a more definitive or long-lasting treatment. I think ceramic must be placed in a patient that has finished the growth of the patient. Of course, for me, laminated veneers for old patients. What I mean old is not young, like, for example, more than 25 years at least. And sometimes people start to place veneers in young patients. I don't like it because young patients change a lot. We see a girl, for example, with 18, 19 years, then we see her like after 10 years, she's a totally different person. The occlusion changes, the face changes, and everything changes. So sometimes we have to think that a composite resin may be a better option for young patients as a diagnostic material, as a transitional material. what we can in the future, we can change to ceramic. So I think like we have to open our mind. For many years, the prosthodontic science always think composite resin as just a material for general dentists. I don't think so. We have to open our mind and see that composite resin is a material that can be used in complex cases for complex oral rehabilitation. We just have to understand that it's not a ceramic. It may work for short term, mid term, but works. So we have to find out what's the best way to work with the material. That's my point. What I think like the CADCAM systems, I think that in a few years, probably everybody's going to work with any CADCAM system. For sure, this is the future. Nowadays, what it's important to understand that the materials that I use more and more for laminated veneers, I work a lot with the IMAX press from Ivoclar. I understand that for years we do laminated veneers just with like feldspathic ceramics or fluorapatite based ceramic on refractor dye technique or even the platinum foil. But this is for artists dental technician. We don't have it everywhere. We just have like some in the world. So we cannot do it for everybody. That's my point. My point is that with the pressed ceramic, you can deliver aesthetics for a great number of patients. That's what I like about IMAX Press, because you can like just do a wax-up. You can even do in CAD-CAM wax-up, and then you produce nice restoration that can be painted on, and you have nice results. Very resistance, very aesthetics, and what is more important, you can reach a great number of people around the world. Regarding composite resin for indirect anterior restoration, I like the Symphony composite resin. It's an indirect resin from 3M EPSP. It's a very useful composite resin. You work as a wax-up because it's a flow composite, and then you can do very thin restoration with that. And of course, another composite resin, laboratory composite resin, there's a lot on the market. You can use them. Doesn't matter. What's important is understand the indication of each material. Okay, I think like there are many differences, cultural difference, technical difference. But in general, what I see is that most of the clinicians thinks that ceramic veneer, for example, is a definitive treatment. It's not. Every time that we touch a tooth surface, you changes everything. So we must control our patient for years. I like to call it a maintenance program. It's a protocol that you call your patient every 6 months, every 8 months to control this patient. I think the healthcare must pay attention more and more in clinical control, and not only just in just doing the procedure. We have to go with our patient, explain to the patient what is important. For example, many patients think that work with bleaching toothpaste is good. Of course, if you don't have a laminated veneer, it's okay. You may bleach your teeth a little bit, but if you have a laminated veneer, sometimes a really abrasive toothpaste may remove the glaze of the ceramic, and you start to destroy the laminated veneers. But this is orientation. We have to teach our patient. That's the main point for me. Of course, there are some differences, Brazil, US, but in general, I think the internets are linking people. Everybody starts to have the same thoughts about conservative and how to preserve tooth. I think that one interesting thing is that what I see in the US, I apologize for that, but the patients don't care too much if you are going to grind it to structure or not. Okay, just prep and just make my teeth brighter. And when I go to some countries like Switzerland, Brazil, the patient says to me, "Doctor, I want a brighter smile, but I don't want you to touch my enamel." So it's a different point. So you go, sometimes some people just looking for just aesthetics, and another country the people are caring a little bit more about the health, how to maintain enamel. What I see in my office today, even the patients, they are becoming really conservative. It's amazing, and that's an important thing that I think. I think it's because the internet, the people before a patient goes to your office, they go to the Google and Google with your name, the procedure that you want to do. They know the material that we're going to use, they asked for it. So we must understand. That's why we, as clinicians, we must be really, really updated in your educational mind to see what the patient is going to ask. That's, I think, the main point when I compare the US and Brazil now. The internet brings good things and bad things, and so we are the, how do you say, we have to filtrate, we have to separate the patient. Look, this is too much, this does not exist, or this is possible. We have to know about almost everything. That's my thinking. The people are really well informed today. They know about everything, or they think they know. But the internet's like, we have to understand that. We have to deal with that. Yeah, the digital smile design, was the name by itself was developed by one of my friends, Christian Coachman. It's a very useful tool, I think. I don't use for everything. In some cases, I do it. For example, when the patient required for, but depends on the case. I think like it's useful, not for every case you can use, but you have to be very good in computer. I think you have to learn how to do it. But otherwise, it's better to do a regular walk-up. So it's time consuming for some people. For example, I work very good with computer, but some clinician does not know how to do it. So long last is a difficult treatment planning for the people who does not how to do it in a computer. But it's good. I think you can use it sometimes, but it's impossible to do in every case. But it's a nice how to say outcome. The Christian idea was great. I think would help a lot when the patient and when the clinician wants to do this design. I think it's good. I think like keep your mind open, understand everything, try to study. When I say study, is just thinking about how can you do the best for your patient. And I always think that dentistry, it's a biological science. So when you are going to prep a tooth, when you need to extract a tooth, we have to preserve as much as possible for any structure. When you extract a tooth, try to preserve the gingiva, try to preserve bone. When you do a preparation, if you need the tooth preparation for a crown or only or a veneer, remember that you are touching tooth structure. It's a biological stuff. It's a biological structure. Thinking yourself always. Thinking what's better for your patient. Yeah. What I like photography a lot. It's a hobby. And my wife, she has a ballet school. And I am the official photographer of the ballet school. And I like to do a lot of picture of ballerinas. And I've been doing it for years. I like also outdoor photograph. I like to study photos. I like very much. And also, I like to go to the movies. I like cinema and movies very well. And I love to travel. I travel a lot because of that. And I used it to play soccer, but I just watch now because of my knees are not so good. I like sports, but I like nowadays more to watch than to do sports. And of course, I like to be close to people that loves dentistry. Dentistry is my passion for sure. Oh, for sure. We're not sure if we're going to win, but sports is always like we have just one winner. That's what sports is. We have to accept that.
Thank you very much.
Thank you. Very good.
For more education programs, visit the Guide Institute at www.guidedental.com.